Hello, my name is Mariana Capistran.
And my name is Emily Wong.
And today in this video, we will be discussing prenatal exercise.
We will discuss how physical activity is important for both the mother and the baby.
The target audience of this video include pregnant women who have been cleared by their doctors to continue exercise throughout their pregnancy. There are some people who are not allowed to exercise during pregnancy due to contraindications. These include preeclampsia, placenta previa, preterm labor, ruptured membranes, or significant heart or lung disease present. Any of the following would contribute to a miscarriage or pregnancy complications.
Why does exercise matter for pregnant women? Physical activity is essential for pregnant women because it enhances overall health, helps control weight gain, reduces pregnancy discomforts, and also prepares the body for labor and delivery. This supports the baby's growth and development as well. One of the main reasons why exercise is important for pregnant women is because it improves physical health. Exercise has shown to strengthen muscles in the pelvic floor, core, and glutes, which improves stability and reduces pain. Exercise also strengthens the heart, blood vessels, and overall cardiovascular health. It reduces pregnancy-related discomforts like back pain, constipation, bloating, and swelling. Exercise also manages weight gain and reduces the risk of gestational diabetes, preeclampsia, and C-section birth.
Not only is exercise amazing for preparing the woman mentally and physically during pregnancy, but it also helps prepare the woman for labor. Research shows that women who exercise regularly during pregnancy have a shorter duration of active labor. According to the American College of Obstetricians and Gynecologists, pregnant women should get at least 150 minutes of moderate intensity aerobic activity every week. And according to the NIH, there were more vaginal deliveries than C-sections in women who exercise regularly.
Benefits for the baby. Exercise during pregnancy has been shown to improve fetal brain development and overall health. This includes improving placental function and potentially leading to a healthier, stronger heart and nervous system, and also reducing the risk of certain complications like preterm birth.
The first category of exercise that we will discuss is low-resistance weight training. This includes lower bodies such as squats. Here we have different varieties of squats, including the regular squat, the sumo squat, a wall squat, and a seated squat. The first step in completing a successful squat is to put your feet shoulder distance apart. Your toes will be pointing ahead and slowly start to descend, bending through the hips, knees, and ankles. Stop when your knees reach a 90-degree angle and then return to the starting position. Some simple modifications shown above are to use a yoga ball or a seat.
The next exercise that we will show on the screen are lunges. As shown in the video, you have to stand with your feet hip width apart, step forward with one foot, bend both knees to go 90 degrees, and then push back to the starting position. Make sure to alternate your legs for each repetition.
Another great low weight resistance training exercise to do while pregnant is a push-up. Push-ups help strengthen the upper body, which will prepare you when you deliver your baby and have to hold them for long periods of time. To do a wall push-up, you can stand with your feet a few feet away from a wall. Slowly bend your elbows and lower your chest towards the wall. Focus on keeping your body aligned as you pause in the position, and then push your hands through and straighten your arms, returning to the starting position. Another variation of the wall push-up is a modified push-up shown on the right. For the modified push-up, place your hands slightly greater than shoulder width apart and your knees comfortably apart. Make sure you contract your abdominal muscles and keep them tight throughout the exercise. Slowly bend your elbows and lower your chest until your chin reaches the ground, then slowly return to the starting position. It is best to do a modified push-up earlier in the pregnancy and a wall push-up later in pregnancy.
The next set of exercises are to improve the pelvic floor muscles. Here we have kneeling sit-backs and hip thrusts. As we mentioned before, pelvic floor exercises are beneficial for pregnant women because they strengthen the pelvic floor muscles, which support the bladder, uterus, and rectum. In order to do a kneeling sit-back, you have to start in a tall kneeling position with a neutral pelvis. Sit back on your heels as tolerated. Return to the start position by fully extending and squeezing your glutes. In order to do a hip thrust, you have to lie with your middle back resting on the ball and your feet flat on the floor, hips width apart. Cross your arms over your chest, or you could have it on the sides right here like the woman in the video. Engage your core muscles and tighten your buttock muscles to lift your hips up into the bridge position.
Next up, we have swimming. Swimming is great for joint pain relief, improved circulation, and muscle strengthening, all while supporting the extra weight and promoting a feeling of weightlessness for the pregnant woman. First up is the freestyle. Focus on a streamlined body position, alternating arm strokes with a flutter kick, and breathing rhythmically to one side. For the backstroke, maintain a flat body position on your back, coordinating alternating arm strokes with a flutter kick, and keeping your head still looking up.
Next, we have the flutter kick and also the breaststroke kick. To do a flutter kick, move your legs in a quick up and down motion, alternating between each leg, kicking down while the other one moves up. Make sure to keep your ankles flexed and your body in a streamlined position. For breaststroke kick, focus on a simultaneous in and out kick with feet turned out, emphasizing a powerful coordinated movement.
Finally, we will be discussing low-impact aerobic exercise. For example, walking. Walking improves circulation, reduces risks of complication, maintains healthy weight gain, builds stamina for labor, enhances overall health, and improves sleep. Walking is an amazing alternative for people who enjoy nature. You can get an experience outdoors with fresh air and also socialize with the people around you. If the weather does not allow you to walk outdoors, you can also walk inside on a treadmill. You can control the incline and speed, as well as remain consistent with your exercise weekly.
Cycling is another great option for aerobic exercise. Cycling and walking have similar benefits. However, cycling puts less stress on the joints in comparison to running while strengthening the muscles around it. Cycling can also be done outdoors or can be done indoors on a stationary bike. It is safer to use a recumbent bike during the later stages of pregnancy to reduce injury.
There are multiple ways that we can accommodate exercise for a pregnant woman. Some of these ways include using equipment like yoga balls, yoga mats, resistance band, chairs, and recumbent bikes. For the first modifications that we showed, the yoga ball was used during the hip thrust and the wall squat. The yoga mat can be used during the modified push-ups. This will provide some comfort for the forearms and as well for any other floor exercises such as the kneeling sit-backs. Not to mention, walking can be done indoors or outdoors, so the use of a treadmill is great for modifying the exercise to your own personal needs. As we mentioned, you can use a recumbent bike in the later stages of pregnancy because it will reduce the risk of falling over outdoors or on a bumpy road. Another great modification is to use resistance bands. They are versatile, adjustable, and can be tailored to accommodate the changing needs and abilities of expectant mothers. Finally, make sure to take everything at your own pace and stop exercise if you start to feel nauseous or out of breath. Be sure to take breaks and sit in between exercises, especially during aerobic exercises where your heart rate will increase.
In conclusion, exercise for pregnant women goes beyond the physical. Exercise during pregnancy offers significant mental and emotional benefits as well. This includes stress relief, reduced anxiety and depression risk, improved mood, and enhanced sleep. This all promotes overall well-being and prepares the mother for motherhood.
We hope that this video was helpful in showing you the importance of prenatal exercise and also allow you to explore different outlets for exercise such as low-resistance weight training, walking, cycling, and swimming, and it'll help improve the overall health of your baby. Thank you so much for watching.